Ever feel like the world of mental health nursing has its own language, its own fundamental rules?
Oh, absolutely.
Well, today we're acting like code breakers, zeroing in on the essential groundwork of psychiatric mental health nursing.
Yeah,
We have a really comprehensive chapter here, the kind that lays the absolute foundation for understanding this, well, incredibly important area of healthcare.
exactly. Think of this as your guided tour through the core principles, the absolute must-knows.
Hmm.
Whether you're already familiar with mental health concepts or, just starting to explore, our aim is to distill this chapter down to its most crucial elements.
That's right. For you, the learner, our mission is crystal clear: to extract the vital knowledge, the real building blocks of effective mental health nursing.
Right.
And at the heart of it all, two concepts keep popping up, two ideas that really define what this field is about: caregiving and coping.
They really do. They're kind of the threads that run through everything we'll be discussing today.
Yeah.
And to get us thinking critically right from the start, the text presents this scenario. A client needs assistance with their use of coping mechanisms to decrease anxiety. What should the nurse do?
Hmm.
It's a question we'll definitely be revisiting later, to see how all these foundational principles inform the answer.
Okay, good. So let's jump into what the text calls the very bedrock: the nurse-client relationship.
Yeah.
This isn't just any interaction you might have. It's a specific therapeutic connection built on some really key ideas.
Precisely. The chapter emphasizes principles like genuineness, respect, and really trying to understand things from the client's perspective, what we call empathic understanding.
Right.
It's about truly seeing the person you're caring for.
Right. It's more than just treating symptoms, isn't it? It's about looking at the whole person.
Absolutely. The text stresses a holistic approach, considering not just the psychological aspects, but also their physical well-being, their social connections, even their spiritual beliefs.
Wow.
What's fascinating is how deeply ingrained a client's cultural and spiritual beliefs can be,
Yeah.
shaping how they respond both to the nurse and to any stressful situations they might be facing. Ignoring that would be a huge blind spot.
It's like these beliefs are a fundamental part of how they make sense of the world and their experiences.
Exactly.
The chapter also talks about setting appropriate limits and boundaries in the relationship. Why is that so important?
Well, boundaries create a safe and predictable space for the therapeutic work to happen.
Okay.
They help maintain a professional focus and ensure the relationship remains centered on the client's needs and goals.
And it sounds like honesty and open communication are the absolute foundation for building trust within that space.
Oh,
We
completely.
can't really have a therapeutic relationship without it.
Trust is paramount. If a client doesn't feel they can be open and honest with the nurse, it's incredibly difficult for them to explore the difficult thoughts and feelings they might be dealing with.
Which brings us to how nurses actually communicate in these situations, using specific therapeutic communication techniques.
Right.
These aren't just casual conversations. They're purposeful ways of encouraging the client to express what they're thinking and feeling, especially around the issues they're struggling with.
These techniques are really intentional tools,
Yeah.
Designed to help the client explore their concerns and gain deeper self-awareness.
And underpinning all of this is confidentiality.
Huge.
The nurse has a responsibility to protect the client's privacy and only share information with the necessary members of the healthcare team. It's a cornerstone of trust.
Absolutely. Clients need to know their personal information is safe and will be handled with discretion.
So ultimately, what's the overall aim of this whole relationship?
It's about empowering the client, really, helping them develop their own ways of tackling problems and coping with challenges.
Okay.
The nurse is more of a guide and a support in that process.
Right, fostering the client's independence and resilience.
That's the goal. And as we touched on earlier, throughout this entire process, the nurse needs to be constantly aware of and sensitive to the client's cultural, religious, and spiritual practices, recognizing how these can be powerful sources of hope and support for them.
Now, this therapeutic relationship doesn't just appear fully formed. It actually moves through distinct phases.
Right. Stages.
The first one is the pre-interaction phase. What's happening here?
Okay, so this is a stage before the nurse even meets the client.
Ah, okay.
It's a time for the nurse to prepare mentally and emotionally for the interaction.
So it's about setting the stage. And the text says the purpose is for the nurse to establish their goals and objectives for when they do connect with the client.
And a really critical task during this phase is for the nurse to take some time for self-reflection.
Self-reflection. Why?
Well, we all have our own assumptions and biases, right? The nurse needs to be aware of these so they don't unintentionally impact the relationship with the client.
Oh, okay.
It's about checking yourself before you connect with someone else.
That makes a lot of sense. Next is the orientation or introductory phase, the first time the nurse and client actually meet.
This is a crucial phase for building acceptance, trust, and clearly defining the boundaries of the relationship.
Okay.
It's about creating a safe and predictable environment right from the start.
Expectations are laid out, and importantly, the time frame of the relationship is also discussed. The text mentions establishing a contract. What does that look like in practice?
It involves clearly outlining the purpose of your work together, what the roles of both the nurse and the client will be, and how long you expect to be working together.
So a clear framework.
Exactly. It provides a clear framework for what's to come.
And during this phase, client-centered goals are also defined.
Yes.
It's all about what the client wants to achieve, what changes they're hoping to make.
Exactly. The focus is on the client's needs and their aspirations for their mental health journey.
Interestingly, the text also points out that even in this initial phase, the topic of termination and separation is brought up.
Right. Early on.
Especially since many therapeutic relationships have a defined endpoint. Why address that so early?
Well, it helps to normalize the eventual end of the relationship.
Okay.
And it gives the client time to process those feelings as they come up. It's about being upfront and transparent from the beginning.
Moving on, we enter the working phase. This sounds like where the real in-depth work happens.
This is where the client's concerns and problems are actively explored, focused on, and evaluated. The nurse's role here is to offer acceptance and practice active listening.
Active listening, it's more than just hearing words, isn't it?
Oh, much more.
It's about being fully present and engaged with what the client is communicating, both verbally and non-verbally.
Absolutely. It involves paying close attention, maybe reflecting back what you've heard to ensure understanding, and showing genuine empathy. The text also highlights the importance of encouraging the client's independence during this phase.
How does that contribute to the overall goal of the relationship?
Well, fostering independence empowers the client, right?
Yeah.
It builds their confidence in managing their own well-being, and it prepares them for when the formal relationship eventually ends.
Okay. Finally, we reach the termination or separation phase. We know preparation for this starts early, but what are the key actions that happen here?
In this phase, the nurse and client review the progress that's been made
Okay.
and evaluate whether the initial goals have been achieved. It's a time to look back on the work you've done together.
And the text mentions some common reactions clients might have to termination, like feeling angry, becoming distant, experiencing a return of symptoms, or even increased dependency.
Yeah, those can happen.
Why do these emotions come up?
Well, ending any significant relationship can bring up a lot of feelings.
Sure.
These reactions can stem from a sense of loss, anxiety about managing on their own, or maybe fear of things getting worse again.
So how should the nurse respond to these feelings as termination approaches?
It's really important to encourage the client to express these feelings openly and honestly. This provides a chance to process them in a healthy way. The nurse also helps the client recognize their own strengths and anticipates what kind of support they might need going forward.
And a crucial part of this final phase is connecting the client with appropriate resources and support systems within their community.
Definitely.
That provides ongoing support after the formal relationship ends.
These referrals act as a safety net. They provide continued assistance for the client in their ongoing mental health journey.
Now, the client isn't living in a vacuum. The text also addresses the importance of the family as an extension of the client.
Right. Family context is huge.
How should nurses approach the family?
Well, viewing family members as potential collaborators in the client's care, while always respecting the client's confidentiality, of course. That's a really important aspect of providing holistic support.
How does involving the family, when appropriate, actually help the client?
Engaging with the family can give the nurse valuable insights into the client's needs and their support system. It allows for interventions that are more tailored and can promote better functioning within the family unit as a whole.
And of course, cultural and ethnic factors will also influence family structures and their needs.
Absolutely.
Nurses need to be really sensitive to these differences.
Understanding the family's cultural background helps the nurse to approach them in a way that is respectful and aligns with their values.
Yeah.
It's critical.
The chapter also highlights the vital role of educating family members. What kind of information is important for them to receive?
Providing education about the client's illness, the signs and symptoms to be aware of, and effective strategies for managing any challenging behaviors.
Right.
that can significantly improve the client's quality of life and reduce stress within the family.
We've talked about the individual and their family. Now let's broaden our view and consider the broader impact of culture, ethnicity, and spirituality on how a client receives care.
Cultural competency is absolutely essential for a mental health nurse, no question.
Yeah.
It allows the nurse to recognize that each client is unique and to understand how their cultural background, values, and spiritual beliefs influence their mental health and how they respond to treatment.
And these factors aren't just abstract ideas. They can actually affect things like how someone responds to medication,
Yeah.
or whether they even seek help in the first place. They can act as either protective factors or risk factors for mental health. That's a powerful influence.
It really underscores the importance of individualizing care.
Right.
What might be considered normal or acceptable in one culture could be viewed very differently in another, and this can impact everything from how symptoms are expressed to what kind of treatment is preferred.
The text also reminds nurses to be really aware of their own cultural baggage, their own influences,
Yes, self-awareness.
and to actively work to avoid any unconscious biases. We all have our own lens through which we see the world.
Self-awareness is key.
Yeah.
Our own cultural background can unintentionally shape how we perceive and interact with clients who come from different backgrounds.
And ultimately, the plan for treatment needs to be a collaborative effort,
Yes.
something that both the client and the nurse agree on, taking the client's needs and preferences into account as much as possible. It should feel like a partnership.
Exactly. It's about empowering the client in their own care and making sure the treatment aligns with their values and beliefs.
Now, let's shift gears and talk about the actual tools nurses use to communicate effectively in these therapeutic relationships, the therapeutic communication process itself.
Right. The how-to. Effective communication is truly the lifeline of the nurse-client relationship. It involves both the words we use and our nonverbal cues, our body language, our tone of voice, everything.
So it's not just about what you say, but also how you say it and even what your body is communicating.
Precisely. And according to the text, successful communication in a therapeutic setting has several key characteristics. It's appropriate to the situation. It's efficient in conveying the message.
Okay.
It's flexible enough to adapt to the client's needs. And there's clear feedback to ensure understanding.
That makes sense. But the text also points out that if either the nurse or the client is feeling anxious, that can really throw a wrench in the communication process.
Big time. High anxiety can make it difficult to think clearly, to express oneself effectively, and to truly hear and understand what the other person is saying. It creates a real barrier.
Exactly. And finally, the text emphasizes that therapeutic communication needs to be goal-directed and always stay within a professional boundary.
Right.
It's not just a friendly chat.
It has a specific purpose to help the client explore their issues and move towards their goals within the context of a professional helping relationship.
The chapter then goes into specific therapeutic and non-therapeutic communication techniques.
The do's and don'ts.
And there's a really useful list of examples of both. Let's highlight a few. On the therapeutic side, we see things like clarifying and validating. How do these help?
Well, clarifying helps to make sure you've understood the client's message accurately. And validating acknowledges the client's feelings and experiences, showing them you're listening and trying to understand their perspective. It makes them feel heard.
Encouraging the client to develop action plans is another therapeutic technique. How does that empower them?
It helps them move from just talking about their problems to actively thinking about and taking steps towards finding solutions. It fosters agency.
Focusing and refocusing are important for keeping the conversation on track.
Yep, keeps it productive.
And addressing the most important issues. It prevents things from getting too scattered.
These techniques help to guide the conversation and ensure that the time is used effectively to address the client's primary concerns.
Providing information and presenting reality can be really important, especially if a client's perceptions are distorted.
It's about offering accurate information in a clear and non-judgmental way to help the client gain a more realistic understanding of their situation, gently correcting misperceptions.
And of course, listening, actively listening, is absolutely fundamental.
The foundation.
We touched on this earlier, but it's worth repeating.
It's the very foundation upon which all effective therapeutic communication is built. Can't stress it enough.
Maintaining neutral responses and even using silence can also be therapeutic.
Silence is powerful.
Silence can give the client time to think and process their thoughts and feelings. It's not always about filling the space with words.
Sometimes just being present and allowing the client to have that space for reflection can be incredibly powerful. Don't underestimate silence.
Providing acknowledgement, feedback, and nonverbal encouragement shows the client you're engaged and supportive.
Right.
Even a nod or a brief, "I understand," can make a difference.
These small cues can build rapport and help the client feel more comfortable sharing. They show you're tracking with them.
Reflecting, restating, and sharing your perceptions are all about showing the client that you're understanding them
Checking your understanding.
and giving them an opportunity to clarify if you've missed something.
These techniques help the client feel heard and understood, and they can also help bring unconscious thoughts and feelings into clearer focus.
Summarizing helps to bring a sense of closure to a part of the conversation
Yeah, wraps it up.
and ensures everyone is on the same page.
It reinforces key points and helps the client see the connections between different aspects of their discussion.
And using broad openings and open-ended questions is a great way to encourage the client to elaborate
Get them talking more freely.
and explore their thoughts and feelings more freely, unlike questions that can be answered with a simple yes or no.
These kinds of questions invite the client to take the lead and share what's truly important to them.
Now, on the flip side, there are non-therapeutic communication techniques that can actually hinder the therapeutic process.
The pitfalls to avoid.
Asking why is listed as one. Why is that generally not helpful?
Well, asking why can often make a client feel defensive or like they're being interrogated. It can put them in a position where they feel they need to justify their feelings or behaviors, which they may not fully understand themselves.
Being defensive or challenging the client's statements is obviously going to damage trust
Immediately shuts things down.
and create a non-supportive environment.
The therapeutic relationship needs to be one of support and understanding, not confrontation or argument.
Changing the subject avoids dealing with the client's real concern
Right. Dismissive.
and can make them feel dismissed or unheard.
It signals to the client that their feelings aren't important, or maybe that the nurse is uncomfortable with what they're saying.
Giving advice, approval, or disapproval takes the focus off the client's own problem-solving abilities.
Yeah, it takes away their power.
And can create dependence on the nurse's opinions.
The goal is to help the client find their own solutions and make their own informed decisions, not to impose our own judgments.
Making stereotypical comments or value judgments shows a lack of respect
Hugely damaging.
for the client's individuality and can be deeply hurtful.
It's crucial to approach every client as an individual and avoid making assumptions based on stereotypes.
Placing the client's feelings on hold minimizes their current emotional experience.
Yeah, let's talk about that later.
Yeah.
Bad idea.
And can make them feel like their concerns aren't valid.
It's important to address feelings as they arise, rather than postponing them or implying they're not important right now.
And finally, providing false reassurance, while often well-intentioned.
Like saying, don't worry, everything will be fine.
Exactly. That can actually dismiss the client's genuine anxieties and prevent them from fully exploring their concerns.
While it might seem helpful in the moment, false reassurance can minimize the client's experience and shut down further communication about their fears. It's not helpful long-term.
Okay. After discussing how we communicate, the chapter then moves into defining what we actually mean by mental health.
Right, the baseline. The text defines mental health as an ongoing process throughout life of successfully adapting to changes, both internal and external.
So, not a fixed state.
Exactly. It's not a fixed state you either have or don't have. It fluctuates.
So it's about resilience, the ability to navigate the ups and downs of life in a healthy way.
Pretty much, yeah.
What are some of the characteristics of someone who is mentally healthy, according to the text?
The chapter highlights that a mentally healthy person is generally in touch with reality,
Okay.
meaning the perceptions are largely accurate. They're able to form meaningful relationships with others and adapt to different social situations, and they can resolve conflicts using problem-solving skills.
So they have a good sense of what's real, they can connect with others, and they have the skills to work through challenges.
That's a good summary.
The chapter also introduces the concept of psychobiological resilience. What exactly does that involve?
Psychobiological resilience refers to our capacity to bounce back from stress and adversity, and it involves both our psychological coping abilities and our underlying biological factors. It's how we maintain or regain our mental well-being even when faced with difficult experiences. Nature and nurture working together, sort of.
Now let's look at the other side of the coin. Psychiatric mental health illness. How does the chapter describe that?
Psychiatric illness is described as a significant disruption in a person's ability to respond to their environment in a way that is harmonious with their own needs and societal expectations.
A loss of adaptive capacity.
Exactly. That adaptive capacity is compromised.
And it's characterized by patterns of emotions, thoughts, or behaviors that impair a person's ability to function in daily life and cause them significant distress.
Right, distress and impairment.
And often distress to those around them as well.
Exactly. These patterns deviate significantly from what's considered typical and healthy and interfere with their ability to work, maintain relationships, take care of themselves, you name it.
The chapter also outlines some personality characteristics that might be present in someone experiencing a psychiatric illness. One is a distorted self-concept. How might that manifest?
Well, they might have an inaccurate view of themselves.
Oh.
Perhaps seeing themselves much more negatively than reality suggests, or, in some cases, having an unrealistically inflated sense of self.
Their perception of their own strengths and weaknesses might also be out of sync with reality.
Right. They might overestimate their abilities in some areas and underestimate them in others.
And that lack of accurate self-awareness can make it difficult.
Yeah, it makes it hard to set realistic goals and to cope effectively with challenges.
The text also mentions that their thoughts and perceptions might not be based in reality.
Right. This could involve things like delusions or hallucinations.
Okay.
These are significant disturbances in their thought processes and how they perceive the world around them.
Their ability to find meaning and purpose in life might be diminished.
Yeah, leading to feelings of emptiness or hopelessness.
That can really impact someone's motivation and overall well-being.
It can affect their engagement with life and their sense of hope for the future. Really profound effects.
Their overall life direction and productivity might be disrupted, affecting their work, their relationships, their sense of accomplishment.
They might struggle to maintain routines, meet their responsibilities, and feel a sense of progress in their lives. Just getting through the day can be hard.
Even meeting their own basic needs, like personal hygiene, nutrition, or safety, might become a challenge.
This can be a sign of significant functional impairment and might require external support to ensure their well-being.
And there might be an unhealthy level of reliance on or preoccupation with their own thoughts and feelings or the thoughts and feelings of others.
Yeah.
This sounds like it could put a strain on relationships.
Oh, absolutely. It can lead to unhealthy dependencies, boundary issues, and difficulties in forming healthy reciprocal relationships.
How does psychiatric illness affect how someone adapts to stress?
Well, their sense of self-control might be diminished, making it harder to manage stressful situations effectively.
Okay.
Their perception of their environment could become distorted, leading them to misinterpret events and interactions.
And crucially, their usual coping mechanisms might be absent or just not work effectively anymore,
Right, the tools aren't working.
leaving them much more vulnerable to the negative impacts of stress.
Without healthy coping strategies, even everyday stressors can become overwhelming and lead to increased anxiety and distress.
Finally, interpersonal relationships can be significantly affected.
Yeah, social impact is big.
They might have fewer social connections, and the quality of those connections might be strained. They might also find it difficult to experience sustained intimacy in their relationships.
Social isolation and difficulties in forming and maintaining close, supportive relationships are common challenges for individuals experiencing mental illness. It's really tough.
The chapter then transitions to a really core concept: coping and defense mechanisms.
Ah, yes, how we manage.
What's the basic definition of coping in this context?
In this context, coping refers to any conscious or unconscious effort that an individual makes to try and reduce anxiety.
Okay.
It's how we attempt to manage stressful situations.
And the chapter talks about different categories of coping mechanisms. Can you break those down for us?
Certainly, coping mechanisms can be broadly categorized as either constructive,
Healthy ones.
right, healthy, leading to positive outcomes long-term,
Huh?
or destructive, which might offer temporary relief but have negative consequences.
Okay.
They can also be task or problem-oriented, focusing on directly addressing the stressor.
Tackling the problem head on.
Exactly. Or cognitively oriented, involving changing how we think about the stressor.
Reframing it.
Yes. Or defense or emotion-oriented,
Mm.
aimed at managing our emotional response to the stress.
Now, defense mechanisms are a specific type of coping mechanism. What's their main job?
Defense mechanisms are primarily used as our anxiety levels increase. Their main purpose is to protect our ego, basically, and decrease anxiety. They are often unconscious psychological strategies we employ without even realizing it.
Table 6101 in the chapter provides a really comprehensive list of different defense mechanisms. It's quite a range.
It is. These mechanisms operate outside of our conscious awareness to help us deal with difficult feelings or situations that might be too overwhelming to face directly. They're protective, in a way.
The chapter section on interventions related to coping and defense mechanisms highlights a few key things nurses should do.
Right, the practical application.
The first is to help the client figure out what's causing their anxiety and explore different ways to reduce it. That seems like a critical first step.
Understanding the source of the anxiety is fundamental to developing effective coping strategies. You can't fix it if you don't know what it is.
Right.
Exploring reduction methods might involve teaching relaxation techniques or helping them develop problem-solving skills.
It's also important for the nurse to assess how the client is currently using defense mechanisms.
Yeah, figure out their patterns.
Are they relying on certain ones more than others?
Identifying the defense mechanisms a client is using can provide valuable clues about their level of anxiety and their typical ways of responding to stress.
And the nurse should aim to facilitate the appropriate use of defense mechanisms. What does appropriate use look like?
It means supporting the client in using defense mechanisms that aren't causing significant problems in their life or hindering their recovery,
Okay.
and perhaps gently guiding them towards more adaptive coping strategies over time. It's not about eliminating defenses altogether, because they can serve a purpose, but making sure they're not harmful.
It's also crucial to determine whether the defense mechanisms the client is using are actually helping them or if they're creating more problems in the long run.
Exactly.
Some defenses can be quite maladaptive.
Right. What might offer temporary comfort can sometimes perpetuate underlying issues or lead to negative consequences in their relationships or overall well-being.
And the text makes a really important point. Nurses should avoid criticizing the client's behavior or their use of defense mechanisms.
So important.
Why is that so vital?
Criticism can increase a client's anxiety and shame, making them less likely to be open and honest with the nurse or to explore healthier ways of coping.
Right.
The nurse's role is to be supportive and understanding, creating a safe space for them to explore these patterns without judgment.
To make these defense mechanisms a bit more concrete, the chapter gives several examples. For instance, there's denial,
Oh yeah, common one.
where someone avoids facing unpleasant realities by refusing to acknowledge them.
A common example might be someone with a substance use problem insisting they don't have a problem, despite clear evidence to the contrary. I can stop anytime I want.
Then there's projection, where someone attributes their own unacceptable thoughts or feelings to someone else.
Right. For example, someone who is feeling angry might accuse their partner of being angry with them, pushing it outwards.
And rationalization, where someone comes up with seemingly logical or acceptable reasons to explain away unacceptable feelings or behaviors.
Like someone who procrastinates on an important task might rationalize it by saying they work better under pressure.
Right. Finding a good reason for it.
Exactly. These are just a few examples, but they help illustrate how these unconscious processes work to protect us from anxiety and difficult emotions.
The chapter then moves on to a really critical tool used in the mental health field, the Diagnostic and Statistical Manual of Mental Health Disorders, often referred to as the DSM.
The DSM, yeah. Published by the American Psychiatric Association, it provides a standardized system for classifying and diagnosing mental illnesses.
So it's like a common language.
Exactly. It's a common language and a set of criteria that helps mental health professionals communicate effectively about these conditions.
It's interesting that the manual takes into account cultural diversity and even includes information about conditions that might be specific to certain cultural groups.
That's crucial.
This really highlights the importance of cultural sensitivity in diagnosis.
Absolutely. Mental illness can manifest in different ways across cultures, and the DSM aims to provide a framework that is as culturally sensitive as possible, although it's always evolving.
The guidelines in the DSM are also essential for helping the healthcare team plan treatment and evaluate its effectiveness. It provides a framework for understanding the client's condition and determining the most appropriate interventions.
A clear and accurate diagnosis based on the DSM criteria helps to guide the development of an individualized and evidence-based treatment plan. It gives you a starting point.
The chapter also defines dual diagnosis, which is also sometimes comorbidity or co-occurring disorders. What does that term refer to?
Dual diagnosis refers to the situation where an individual has both a mental health disorder and a substance-related disorder at the same time.
Okay.
This is a complex situation that often requires integrated treatment approaches that address both issues simultaneously. You can't really treat one without considering the other.
And for the most up-to-date information on the DSM, the chapter directs listeners to the American Psychiatric Association's website.
Good advice.
It's a field that's constantly evolving with new research and understanding, isn't it?
It is, and staying current with the latest diagnostic criteria and research findings is essential for mental health professionals to provide the best possible care. You have to keep learning.
Moving on to a really important practical aspect, the chapter discusses the different types of mental health admissions and discharges,
The logistics and legalities.
which has significant legal and ethical implications. Let's start with voluntary admission.
Okay. Voluntary admission occurs when a client or their legal guardian willingly seeks admission to a mental health facility for treatment.
They choose to come in.
Exactly. They are actively choosing to receive care.
And a key characteristic of voluntary admission is that the client generally has the right to request to leave the hospital.
Right. They can sign themselves out.
Although this usually involves notifying their primary healthcare provider and getting any necessary prescriptions.
That's correct. Unless there are specific and serious safety concerns, voluntary clients have the autonomy to decide when they want to leave.
The text explicitly states that detaining a voluntary client against their will constitutes false imprisonment
Huge legal issue.
that has serious legal ramifications.
It's a violation of their fundamental rights and can lead to legal action. The chapter also emphasizes that individuals who are voluntarily admitted retain all of their civil rights.
This includes things like the right to vote, to manage their own finances, and to communicate freely with others.
All those basic rights remain intact.
Now let's talk about the right to confidentiality, which applies to all clients regardless of how they were admitted.
Confidentiality is a cornerstone of healthcare ethics and law, absolutely fundamental. Clients have a right to privacy concerning their medical information. The Health Insurance Portability and Accountability Act, or IPA,
Yeah.
of 1996, provides federal protection for this confidentiality, especially regarding the release and electronic transmission of health information.
However, there are some specific exceptions to this right to confidentiality, aren't there?
There are, yes, very specific ones.
The text mentions situations where information might need to be disclosed in life-threatening emergencies even without the client's direct consent.
That's correct. In situations where there is an immediate risk of serious harm to the client or others, the priority shifts to ensuring safety. Safety trumps confidentiality in those rare moments.
And there's a specific legal duty to warn potential victims if a client makes a credible and specific threat of harm against an identified person,
Right, the duty to warn.
often referred to as the Tarasoff rule.
This is a critical legal and ethical responsibility for mental health professionals. You have to act on credible threats.
The chapter also emphasizes that, except in those emergency situations, any release of a client's confidential information requires their informed consent.
Yes, informed consent is key.
This consent needs to be specific about what information is being released, to whom, and for what purpose, and for what time frame.
Informed consent is essential. Clients need to understand what information will be shared, with whom and why, before they agree to its release. They need to know what they're signing.
Now, let's move on to the more complex topic of involuntary admission. When might this become necessary?
Involuntary admission may be necessary for individuals who are experiencing a mental illness and, as a result, pose a danger to themselves or others.
Danger to self or others.
Or when they are so impaired by their illness that they are unable to meet their basic needs, sometimes called gravely disabled, and require psychiatric treatment or physical care, but are unwilling or unable to seek it voluntarily.
So it's often based on the presence of an actual or imminent risk of harm.
Exactly. Imminent risk is usually the trigger.
What are the key legal rights of someone who is involuntarily admitted? Because they still have rights.
Absolutely. It's crucial to understand that even when someone is admitted involuntarily, they retain many fundamental rights, such as they generally have the right to give informed consent for treatment, and they also have the right to refuse treatment, including medications.
Even if they're involuntary.
Yes, unless a specific court order has been obtained to override that right.
Ah, okay. There's a caveat to that right to refuse treatment, though, isn't there?
Yes. In emergency situations where a client poses an immediate and serious danger to themselves or others, and immediate intervention is necessary to prevent harm,
Okay.
treatment, including medication, may be administered without a specific court order at that precise moment of acute risk to prevent injury.
Got it. The process for involuntary admission typically involves a legal component.
Always.
usually requiring a court order from a judge, unless it's a very short-term emergency situation while that order is being sought.
Right. There are emergency holds, but formal commitment requires judicial review.
And in all cases of involuntary admission, the client has the right to be provided with legal counsel to represent their interests.
A really important safeguard.
Absolutely. It ensures that their rights are protected throughout the legal process. A court hearing is held within a specific time frame after an involuntary admission,
Usually pretty quickly.
and this time frame varies depending on the state or jurisdiction.
Right. State laws differ on the exact timing.
The client also has the right to seek a prompt legal review of their detention, often through a legal process called a writ of habeas corpus.
Correct. This allows them to challenge the legality of their confinement. Basically asks the court, why are you holding this person?
Okay.
This provides a mechanism for the client to have a judge review their case and determine if there is sufficient legal basis for their continued detention.
At the court hearing, the judge will make a decision about whether the client should be released, whether they should be detained for further psychiatric evaluation and treatment, or whether they should be formally committed
Yeah.
to a mental health facility for a longer period.
The judge's decision is based on the evidence presented regarding the client's current mental state, the risk they pose to themselves or others, and their need for continued treatment.
Another really important right for involuntarily admitted clients is the right to treatment in the least restrictive environment.
Very important principle.
Can you explain what that means in practical terms?
It means that if the client's treatment needs can be safely and effectively met in a less restrictive setting, like outpatient therapy or a partial hospitalization program,
Okay.
then that is the preferred option over full-time inpatient hospitalization. The goal is to provide necessary care while maximizing the client's autonomy and freedom as much as safely possible.
The text also clarifies that a client is presumed to be legally competent to make their own decisions,
Presumed competent, yes.
unless they have been specifically declared incompetent through a separate legal hearing, which is distinct from the involuntary commitment hearing.
Involuntary admission itself does not automatically mean that a person is legally incapable of making their own decisions about their life and treatment. It's a separate legal finding.
And if a nurse has concerns that a client might not be able to make informed decisions about their care,
If they seem unable to understand the risks and benefits.
right. The chapter states that the nurse has a responsibility to initiate the process for a competency evaluation by the court.
Yes.
This could potentially lead to the appointment of a legal guardian to make decisions on the client's behalf.
It's about protecting vulnerable individuals who may lack the capacity to understand their treatment options and make sound choices about their well-being.
Now let's discuss the different ways a client can be released from the hospital.
Discharge options.
The chapter outlines a few different scenarios.
Right. A client can be released voluntarily, if they were admitted voluntarily, against medical advice or AMA.
AMA.
If they choose to leave despite the treatment team's recommendations, or with conditions, which is known as conditional release.
We've already talked about voluntary release. The client has the right to leave upon their request unless there are immediate safety concerns.
Right.
If the healthcare team believes the client is still a danger to themselves or others, they can initiate the legal process for involuntary commitment while temporarily holding the client.
This provides a necessary safety measure to ensure the well-being of the client and the community, while a more formal legal evaluation can take place. It bridges that gap.
Some states have a process called conditional release, particularly for clients who were involuntarily hospitalized. What does that involve?
Conditional release means that a client is discharged from inpatient care, but is required to participate in ongoing outpatient treatment for a specified period.
Okay, so follow-up is mandatory.
Exactly. This allows the treatment team to monitor their progress, ensure they're adhering to their medication and therapy, and assess their ability to reintegrate into the community successfully. It's like a step-down approach.
And if a client who is on conditional release doesn't follow the outpatient treatment plan or experiences a relapse, can they be readmitted more easily?
Yes, typically.
Yeah.
Because the original involuntary commitment order is still technically in effect during the period of conditional release. They may be readmitted to the hospital without going through the full new involuntary admission process. It's a quicker return if needed.
Finally, there's unconditional release or discharge, which signifies the end of the formal relationship between the client and the hospital or treatment facility.
Clean break.
This can be initiated by the psychiatrist, the court, or the administration for clients who are involuntarily admitted, and it can be requested by voluntary clients at any time. And as with involuntary admission, clients can also seek judicial discharge through a writ of habeas corpus.
Right. Discharge planning and ensuring appropriate follow-up care are absolutely essential for the ongoing well-being of individuals with mental health conditions. It's not just about the client leaving the hospital. It's about having a comprehensive plan in place for their continued recovery in the community.
Aftercare case managers play a really vital role in this
A
process,
huge role.
helping to connect clients with community resources and providing ongoing support to prevent relapse and ensure a smooth transition back into their daily lives. It's like building a bridge for them.
They help clients access necessary services like housing, employment support, continued therapy, and they can also provide early intervention if any difficulties arise after discharge. They're the safety net.
The chapter then turns its attention to milieu therapy. What exactly is the milieu in a mental health treatment setting?
The milieu refers to the overall therapeutic environment, the entire physical and social context in which a client receives treatment.
The whole vibe of the place?
Kind of, yeah. It's about creating a safe, supportive, and structured setting that promotes healing and recovery. Everything is part of the therapy.
Safety is emphasized as the absolute top priority in managing the milieu.
Has to be.
That makes perfect sense. Clients need to feel secure in order to focus on their treatment. And the idea is that all interactions within this environment have the potential to be therapeutic.
Exactly. Every interaction between clients, staff, and the physical environment itself can be an opportunity for learning and growth in a well-designed and managed therapeutic milieu. Even interactions between clients.
The text highlights that all members of the treatment team play a role in planning and maintaining the milieu.
It's a team effort.
This includes a wide range of professionals working together.
Yes, it's a multidisciplinary approach involving nurses, social workers, therapists, psychologists, psychiatrists, techs, other support staff. Everyone contributes to creating and sustaining a therapeutic atmosphere.
And a core principle of milieu therapy is empowering the client. How is this achieved in practice?
Empowerment is fostered by actively involving clients in setting their own treatment goals and developing meaningful, purposeful relationships with the staff. It's about giving them a sense of ownership and control over the recovery process, even within the structure of the unit.
Next, the chapter discusses group development and group therapy. What is group therapy in its essence?
Group therapy involves a therapist working with a small group of typically 5 to 8 individuals.
Small group.
Yeah, usually, who are all focused on their own personal goals within the context of the group. The group setting provides a unique opportunity for members to receive feedback, support, and learn from each other's experiences. It's powerful.
Group therapy also tends to unfold in distinct stages.
Like the relationship phases, yeah.
What characterizes the initial development of a group?
In the early stages, communication is often more superficial.
Testing the waters.
Exactly. As members are just getting to know each other and haven't yet built a strong sense of trust, they're often looking for common ground and trying to understand the group's purpose and goals. There might be some initial uncertainty about what to share and how open to be.
So it's a bit of a getting acquainted period where people are establishing some initial connections.
Right.
The text also mentions the development of group norms, roles, and responsibilities during this phase. These are the unwritten rules and expectations for how the group will function, right?
Exactly. Norms define what's considered acceptable behavior within the group. Different roles might naturally emerge as members take on certain functions, and responsibilities are clarified to ensure the group operates effectively.
Okay.
Interestingly, the topic of termination, the eventual ending of the group, is often introduced even in these early sessions.
Then the group moves into the working phase. This sounds like when the real therapeutic progress happens.
Yes, once members feel more comfortable and have developed a greater sense of trust and safety, they can begin to address their personal problems more openly and honestly.
Okay.
Both disagreements and cooperation can emerge as members learn to work together, offer support, and provide constructive feedback to one another. It gets real.
Conflict in a therapeutic setting might seem counterintuitive,
But it's necessary sometimes.
but it can actually be a really valuable opportunity for growth, can it?
Absolutely. Learning how to navigate disagreements and resolve conflicts in a healthy way within the supportive environment of the group is a key part of the therapeutic process. You learn relationship skills.
And finally, there's the termination phase of the group, which we heard is actually addressed right from the beginning.
Yep. Plan for the end from the start.
What are the key aspects of this final stage?
In the termination phase, members have the opportunity to explore their feelings about what they've accomplished in the group and the emotions that come with the group coming to an end. Saying goodbye.
Mm-hmm.
This provides a chance to learn how to deal with the normal human experience of endings and separations in a more healthy way. Practice letting go.
The chapter also briefly touches on self-help or support groups.
Like AA, NA, and AMI groups.
Right. There's a list of examples. What's the core idea behind these types of groups?
The fundamental principle is that people who share similar problems or experiences can offer each other unique understanding, support, and practical advice that professionals alone might not be able to provide.
Peer support.
Exactly. It's peer-to-peer support based on shared lived experience. Very powerful.
Lastly, the chapter covers family therapy. What's the fundamental idea behind this therapeutic approach?
Family therapy is based on the understanding that the individual who is exhibiting symptoms, the identified patient,
Okay.
is often signaling underlying problems within the entire family system. It views the family as an interconnected unit, and it assumes that changes in one member can lead to changes in others.
So the focus isn't just on the individual client, but on the dynamics and relationships within the family as a whole.
Precisely, looking at the whole system.
What's the therapist's role in family therapy?
The therapist's role is to help family members identify and express their thoughts and feelings in a safe and constructive way, to help them understand the patterns of interaction within the family.
The dance they do.
Yeah, exactly. To assist them in redefining their roles and rules, to encourage them to try out new and more effective ways of relating to each other, and ultimately to help the family restore its overall strength and healthy functioning.
Now let's come full circle back to that critical thinking question we started with. A client needs assistance with their use of coping mechanisms to decrease anxiety. What should the nurse do?
Right, bringing it all together.
Based on all the foundational principles we've explored, what would be the initial steps and considerations for the nurse?
Okay, so, as we've learned, coping mechanisms are any efforts to reduce anxiety. The chapter emphasizes that the nurse's first step should be to help the client identify the specific source of their anxiety.
Find the trigger.
Exactly. Once that's understood, the nurse can then explore various methods with the client to reduce their anxiety, maybe teaching them relaxation techniques or helping them develop problem-solving skills.
Okay.
If the client is using defense mechanisms, the nurse should assess whether those mechanisms are effective or causing additional distress.
Helpful or harmful?
Right. And facilitate their appropriate and constructive use while always avoiding any criticism of the client's behavior or their chosen defenses. Support, don't judge.
That really brings together so many of the key concepts we've discussed. This chapter also includes a series of practice questions,
Good way to test yourself.
which are a fantastic way to test your understanding of these foundational principles. While we don't have time to go through each one in detail, we touched on several earlier, looking at the rationale behind the correct answers.
Yeah, those rationales are key.
These examples really highlight how these fundamental concepts apply in practical nursing scenarios, from therapeutic communication techniques to understanding different types of admissions and recognizing defense mechanisms.
Indeed. Working through those practice questions can be incredibly helpful for solidifying your grasp of these essential concepts in psychiatric mental health nursing. Highly recommend doing them.
Well, the learner, we've taken a truly deep dive into the foundational concepts of psychiatric mental health nursing presented in this chapter.
Covered a lot of ground.
We've explored everything from the crucial elements of the nurse-client relationship and the nuances of therapeutic communication to defining mental health and illness, understanding coping and defense mechanisms, the role of the DSM, the legal and ethical considerations around admissions and discharges, and the therapeutic benefits of milieu, group, and family therapies.
We've covered a significant amount of ground, laying a solid groundwork for understanding the complexities of mental health nursing practice. Hopefully it feels a bit less like a foreign language now.
So as you continue your learning journey, consider this. Reflecting on all the principles and concepts we've explored today, what single aspect of psychiatric mental health nursing do you believe is the most fundamental to providing truly effective and compassionate care, and why might that be?
Ooh, good question to ponder.
It's definitely food for thought.
And with that, we can confirm that we have thoroughly explored all the key concepts presented in this comprehensive chapter on the foundations of psychiatric mental health nursing.